Hi there, I'm Chris Cannell. I'm going to be teaching you your Medicare basics today, and thank you so much for joining my webinar. I've been teaching this webinar for years now. I've taught thousands of people. As you've probably seen, I've got hundreds of 5-star reviews. You're in the right place. You're going to get a good quality education today. No sales going on, just good education. And you'll get an opportunity to make an appointment with me. I got started in Medicare through helping my late grandmother, Miss Audrey McNeil. My mother passed when I was younger through a tragedy, and Meemaw became like my mother at an early age, teenager. By that time, Meemaw was already on Medicare, but it had not been set up correctly. We're gonna go page by page through my presentation here. Quick note, you may wanna add me to your phone because you guys are getting killed with telemarketers right now. And so if you have me call and you don't know that it's me, then you might just not answer. So if you like, add me as a contact in your phone so that if you have me call, you know it's me and not one of these telemarketers. First off, we're going to cover your Medicare basics, including getting into the Medicare program itself. And then we're going to cover what do you get with that? Your A and B card, what does it represent? And then we're going to cover plan basics, Medicare plans. Why would we need one? What are the main types and what are the differences? And then I'll answer any questions about those in our one-on-ones if you make your time with me for that. But I think you'll be very clear after this presentation, and then you'll have just maybe a few follow-up questions from there, which we'll easily be able to take care of with you. How do we get into the government program called Medicare successfully and without any errors and on time? It gets real simple real quick. There's only two groups of people. Group one. Group one are people who are already receiving money from the government. What does that mean? That means you're already got your Social Security turned on and are receiving Social Security funds or disability funds, or if you happen to be part of the Railroad Retirement Board, all right? Any of those right there means you're getting money from the government. That's the only money that counts, money from the government in this way. Then you're going to be automatically enrolled into Medicare, right? If you're getting money from the government, you're automatically enrolled. You're going to see that card they send you is a partial package. Medicare is a partial package. We need to get something else in place, a Medicare plan of some kind, to hold hands with it, to fill the gaps in it, and to provide you with the required drug coverage. Group 2 are people not yet receiving money from the government. So if you are not yet receiving money from the government, then you have to manually enroll into Medicare. Now, when are you going to need to enroll in Medicare if you're manually enrolling? Well, here's how it works. You're going to get a 7-month window. It starts 3 months before your birth month, right? And then it ends 3 months after your birth month. But here's the deal, pro tip. Don't wait past the first or second month. Why? Well, as we said, you're going to need that card and the number on it in order to handle certain business. And if you don't have that card by here, then you may not have any coverage starting here on month 1 after your 65th birthday because you couldn't get anything in place because you didn't have the card number. All right, we're going to fast forward now and say you've successfully enrolled in Medicare or you were enrolled automatically and your card has shown up in the mail. Good job. And the card shows A and B on it. Now, what the heck does that mean? What do you get with the A and the B? What do they cost? What do they cover? And what do they not cover? That's what we're going to dig into next. What does Medicare give you with that A and B card, and what do they not give you? Medicare Part A is where we'll start. Here's the way I learned. The outside of the A looks like a roof. You think roof, hospital. A covers hospital costs. That's what you need to remember. Yes, it's also related to a few other things, but the main thing to take away and retain, A is related to hospital costs. Roof, hospital. Now, A does not have a monthly payment. Why? Well, during your working life, you notice they were taking a tax item out of your payroll taxes and it showed Medicare. This is what you paid for out of your payroll taxes. If you worked at least 10 years in your life, then you do not pay for Medicare Part A. Or if your spouse worked at least 10 years, then you're covered for A, for no extra cost under your spouse's work history. Either you or the spouse worked at least 10 years, there's no monthly payment for A. However, A does have a deductible. And what is and here's the amount, $1,676. Now, what does that mean? Most of you know what a deductible is, but just to reinforce it, a deductible is what I have to deduct from my wallet before anybody is going to pay anything other than me. In this case, what I have to deduct from my wallet is $1,676 at the hospital per hospital visit. Now, they give you a pass if you've been in as an inpatient in the last 60 days. But if it's been more than 60 days, it's $1,676 each time you visit. Let's pause a second. What we're starting to see is Medicare itself, original Medicare, A and B, is a partial package. It's full of holes. This is hole number one of several that we'll see. And this is why, as you're going to see as we go on, we need a different plan by a private insurance company called a Medicare plan to cover up these holes. And we'll have two ways we can do it. One will cover up this $1,676 altogether. It'll absorb it all. The other route that you're going to choose will cover most of it, but not all of it. It'll be cheaper, but we'll leave you paying some of that. So we'll cover those later, but just know, don't get sticker shock too much here. You are not going to end up having to pay this $1,676 if we're working together, because I'm going to have you on one of these two routes that's going to absorb either all or most of that. In addition to the deductible, Medicare Part A has daily costs in the hospital that you're responsible for. After day 60 in the hospital, you owe $440 a day. After day 90, it's like $880 a day. Then it goes to, after day 150, all of it a day. Again, don't get sticker shocked. The takeaway is A has holes in it, the deductible and these daily costs. But we're going to choose something later that's going to cover up all of that for you. But this is why Medicare plans exist and brokers like myself. I'll get you matched up with something that'll take care of that. This is what naked A is just from the government. You don't want to just have that only, but that's what it is by itself. B. If A covers hospital costs, B then covers the other main item, which is, that's right, doctor costs. B covers doctor costs, important, not only in the office setting, but also in the surgical setting and in outpatient surgery setting and so forth. That's what B is about, doctor costs. Now, B has a monthly payment. Now, if you didn't already know this, please don't shoot the messenger. I hate the fact that it's the case, but they do charge a monthly payment for Medicare Part B. Medicare Part B costs $185 a month in 2025. If you're on Social Security, they'll draw the $185 a month directly out of your Social Security funds. They'll begin doing that the month before you turn 65. $185 a month for Social Security. If you're not on Social Security yet, then they will send you a quarterly bill for $185 times 3, which is $555. Now, you can later set that up on an auto pay out of a checking account if you get with them to do that, but that's not how you'll get your first bill. The only option is a quarterly bill if you're not yet on Social Security. They don't have anything to take it out of, so they'll send you a quarterly bill. $185 for Medicare Part B. Now, Part B also has its own deductible. Deductible, $257 for the year. Where does it come up? At the doctor's offices. What does that mean? You pay the first $257 out of your wallet to start the year, total among all doctors, not each office. Once you have satisfied in total $257 out of your wallet, then Medicare Part B kicks in. What does it pay then? After you've satisfied your $257, then Medicare pays 80% and you pay 20%. But listen, that right there is actually the biggest hole in Medicare, because the 20% you owe is unlimited. And here's how this comes up. Let me show you the next slide. Let's say you have a major organ surgery, right? Let's say it's a heart procedure, which is not uncommon. Well, in a procedure like that, there's multiple doctors involved. There's a cardiologist, pulmonologist, anesthesiologist, and then probably your general practitioners poking around in there too somewhere, right? Let's say that the doctor bill was $100,000 for this organ surgery. If Medicare Part B covers doctor costs, and their portion they're going to cover is 80% of these costs, then 80% of the $100,000 bill means they're going to pay $80,000, and you're going to owe what? Exactly, $20,000. That's rough. Plus, you would have been an inpatient for this, and so you'd had to pay that deductible of $1,676. $20,000 plus the deductible, that's a chunk of money. Most people are not comfortable having that sort of liability over their head. This is another reason people don't hang out with naked Medicare Part B with the B card only. If you have a plan in place, like I will help you get, then it's going to cover up this 20%. It's going to either pay all of it or most of it, depending on which of the two routes you choose later. But just know, this is why we don't hang out with A and B only. B has got the biggest hole in Medicare, that 20% you owe, and that's an unlimited 20%. There's no max on what the 20% can become. All right, so stay tuned for other important information about how to avoid liability like that. All right, next up, prescription drugs. Now, this is the only letter in this whole alphabet soup that actually makes any sense. Why? D stands for drugs. That's something we can all remember. D stands for drugs. I wish it were all so easy. Listen, quagmire here. Medicare requires you to have a drug plan, whether you're taking any meds or not. But they don't give you one. That A and B card has no drug coverage associated with it. There's no D on that A and B card. They say that you must have it, and if you don't get it when you're supposed to get it, they will penalize you, and then that penalty accrues and stays with you for life. We don't want to make the mistake of not putting some kind of drug coverage in place. But again, stay with me. I'll show you. It's not very hard to do, not very expensive to put in place for most people, and I'll assist you with making sure that error is not made. Drug coverage is required. Now, you'll never spend more than, and by the way, drug plans start at $0 a month and they go up from there, but many of them are on the lower end range. Copays on your drug is another matter. Monthly payment on the drug plan, that's one thing. Copays on your drugs is a different thing, right? We've got monthly payment, and then we've got copays. Two separate things, right? As I say, monthly payments, pretty affordable in most cases, free in some cases, as we'll see in a minute. Copays are gonna be based on your drugs, obviously, right? We'll look a little bit more about how that works in a moment, but here's a thing I want you to know. In 2025, a new law took effect that shows that you'll never spend more than $2,000 in a single year on your drug costs. Now, the monthly payment doesn't count, but any deductible for your drugs or any copays themselves for the drugs all count. If you get to $2,000, or really a little shy of that actually, then you're done for the year. You will not have to pay any more costs anymore for the remainder of the year. That's the max out of pocket for your drug coverage. Now, let's take a little bit look about how drugs work. You can go way down the rabbit hole on the drug plan stuff, but it's not necessary. I'm going to give you the basics that you need to know about how drug plans work. They all work, no matter what kind you get, on a tier system. And tier 1 and tier 2, these are your cheapest drugs. These are your maintenance drugs, like lisinopril, atorvastatin, meloxicam. All of your maintenance drugs are gonna be right here. These have the lowest copays. Tier 2, again, all that, very moderate, $5, $10 copay. Most of these are zero copay. Now, when you get to tier 3 or higher, you're gonna be A, dealing with deductible. Any drugs that are, if you hit a drug that's on tier 3 or higher, you're going to pay, not for each drug, but for one of the drugs on tier 3 or higher, you're going to pay the first either $420 to $590 per year. What drugs are these? These are like Ozempic, Farxiga, Mounjaro, albuterol, various ones like that. I'll tell you when we deal with one another one-on-one, you will submit your drugs to me prior to our appointment. I'll have the homework done, and then when we talk, I'll let you know what tier your drugs are on and what you can expect for your copays. But just know, if it's any that are on tier 3 or higher, then you'll pay the first deductible of the year to start before the coverage helps you. Then the coverage will have its own copays depending on what the drug is after that. Copays. First the deductible, and then copays after that. And again, we don't have to get too deep into that. That's the basic framework for how all drug coverage works. I will match you up with the correct plan that's going to save you the most money for your drugs, and I'll report to you what that is and how it works when we get together, all right? Now, we're at the point where we have to look at what type of Medicare plan are we going to want to cover the holes that we have seen are in standard issue government Medicare. And when it comes to choosing a plan, there's two pathways. Pathway 1, supplement plan. Pathway 2, advantage plan. Advantage plan, think Joe Namath on the TV. You've probably seen those commercials and so forth. You're going to choose between these two pathways. Now, all carriers have both of these pathways. By the way, you'll see the calendar below you here in the webinar. You can go ahead and start making an appointment. My slots do fill up quickly because I do this teaching a lot. I help a lot of people across the country. Don't be bashful about going ahead and securing your appointment at any time. This one is the one that's been around the longest. The supplement plan is the more comprehensive of the two routes medically. And here's how it works. You pay a monthly payment to a carrier, let's say $100 a month plus. And you also have to, of course, pay your $185. Now, everybody always asks me about these two pathways. Hey, when I choose these pathways, do I still have to pay the $185 for Medicare Part B to Medicare? Yes. Unfortunately, unless you're on one of those programs for the disadvantaged, where your state pays your $185 for you, the $185 is a fixed cost that you can expect, regardless of which of these private insurance routes you add on. These are separate add-ons that you'll need, right? But as you'll see in a minute, the next route has no cost. This one's more expensive, but more comprehensive medically. Stay with me. Yes, you pay your $185 to Medicare, then $100 plus to a carrier. I'll write that here. Let's say $100 plus. The $100 plus is because it depends on what state you're in and what zip. It's a little bit different per state. When we get together, I'll let you know what to expect. But for now, let's say $100 plus. In exchange for you paying this $100 plus, the carrier then covers almost all of the gaps, right, in your Medicare A and B. All right. As I say, don't worry. I've got a $0 option later, but this is the more comprehensive one. To know and understand, supplement plan is the only health insurance in America that doesn't have a network. So your insurance through your employer currently, if you have that or ever had it, network based. The other route we're going to look at next, Advantage Plan, Joe Namath, network based. Medicare with a supplement, only insurance that has no network. That means you can go to any hospital, any cancer facility, treatment facility, doctor's office in the country that accepts Medicare, and 99% of all of those take Medicare. They make their money on it. If no network is important to you, put a star next to this one. This one is federally regulated. So the supplement plan framework is exactly the same carrier to carrier. The way Aetna supplement plan covers your costs is exactly the same as the way a Mutual of Omaha or a Blue Cross. There is no difference. There can't be difference. It's federally regulated, so it's a carbon copy. The only difference is the monthly payment. No difference in coverage from United Healthcare to Aetna to Mutual of Omaha when it comes to a supplement plan. All right? Only the payment. Now, how, by the way, one note, these also have another nickname called Medigap. Medigap and supplement are the same thing, just two different terms. Some people call it supplement, some people call it Medigap. I'll refer to it as supplement, but same term there. Now, how do these pay out? This one pays that $1,676 at the hospital. This one pays all of your other daily hospital costs. Here's the thing to take away. At the hospital, you don't pay anything with a supplement plan. You're covered at 100%. It doesn't matter what they do to you at the hospital, and it doesn't matter how long you're there, up to 365 days. There's no more comprehensive coverage than that. 100% coverage at the hospital with nothing out of pocket for you. Now that's it for the supplement plan. Next, we'll go on to the only remaining pathway, which is the Advantage plan. All right. You guys seen this commercial on TV? Is it just me? Oh, you have? Good. I thought I'm watching Gunsmoke, and the next thing I see these guys on my TV all the time, right? This is a coverage that came around in the 90s called Advantage Plan. And this is a very convenient local network-based option, right? It's got some real upsides in terms of its affordability and convenience. And dental, vision, hearing, prescription drug coverage, yes, those are all built in. But it's also got some disadvantages to the Advantage plan, and we'll look at both the pros and the cons now, all right? The cost. The cost is about $0 to $45 a month. You can get them from $0 up to about $45 a month. This one, you do not have to pay that first $257 at the doctor's office to start the year. This one, you don't have to pay anything, $0, when you go to see your primary care doctor. And I'll write that here. $0 primary doctor. And then a specialist is going to be about $45 for the specialist. Now, this route is not federally regulated, so each of these plans will be a little bit different carrier to carrier. But this is the general framework. About $0 at the primary, about $45 at the specialist. Can be different, but going to be right in this ballpark. There's never a health check required for an Advantage plan at any point in your life. These are always, everybody's accepted. These do include some dental, vision, and hearing. Not a ton for most, but a fair amount. People who are disadvantaged get more dental, vision, and hearing in their goodie bag. This one does include drug coverage built in, so there's no extra monthly payment for adding on drug coverage. No $16 extra or $21 extra, it's just part of your package. You do still have a deductible if you have drugs on tier 3 or higher, because as I said, that framework for drugs with the tiers is the same regardless of what we get for drug coverage. Otherwise, your copays on your drugs will be what they'll be, and often the copays for tier 3 or higher drugs will be a little bit less on an Advantage plan. That's one of the carrots they use to attract you, is it can be a bit better on the copays for some of the more expensive drugs. Now, these though have some downsides, and one of the downsides is obviously it's network-based, so you have to stay within a network of doctors and providers. So if you went with an Aetna plan, you need to have Aetna doctors and facilities that you're going to and so forth. That's what we're going to do in the one-on-one is I will get your doctor names and your drugs, and with the doctors and local hospital, I'll make sure that I'm only presenting to you those plan options that your doctors and your facilities in your area accept. That way there's no chance of us putting you on something that's your doctors say, oh, we're out of network for that, we don't take that. There's working with me, there's no chance of that. Lastly, thank you for attending the webinar. Why would you make an appointment with me or talk to me about any of these things from here? Well, here's my perspective. I feel like you're likely going to need someone to enroll you in a Medicare plan, as we've seen. A Medicare plan is going to need to be added to your A and B card to fill those holes. I think that person should be me. Why do I think that? Well, let me break it down for you. Why call an 800 number and deal with some stranger that you will likely never get on the phone twice when you have somebody here with over 500 five-star reviews and thousands of customers I've helped that you can get on the phone or text or email me when you need me, is number one. I'm here, I've got hundreds of reviews, and I don't mean to toot my own horn too much, but the truth is I feel like I am more knowledgeable than most of the people you're going to get on the other end of an 800 number. And that includes the people you might get calling direct to a carrier, right? I've just been doing it with so many different people in different markets and different plans that I just have that breadth of experience I feel like I bring to the table that you're going to have a hard time finding at the other end of an 800 number. Also, I'm fixing problems all the time that people are coming to me with that somebody on an 800 number put them on a plan that wasn't right for them. And so why even make that mistake? Rates with me are the same as they are direct to carrier. I've got direct to carrier rates in almost every situation. And lastly, hopefully after this, because you like me. Again, it's very easy. My help is free. You just make an appointment down below using the calendar link. I will then send you a confirmation email and text of our appointment. I'm paid by carriers for helping you, so there's no cost. And please right now, put a time on my calendar so that we can speak directly. All right? I look forward to helping you.